What you're about to witness is Republican Congressman Adrian Smith of Nebraska, a man who has spent nearly 2 decades voting to dismantle the Affordable Care Act, now questioning insurance executives about why premiums are so high. The irony would be laughable if it weren't so devastating. This comes just weeks after the Trump administration allowed enhanced ACA subsidies to expire, sending premiums skyrocketing for millions of Americans. And yet, here sits Representative Smith, blaming Obamacare, a law he's tried to repeal over 50 times for problems his own party created. Across from him, David Cordaney, the CEO of Cigna, a man who took home over $90 million in a single year. These are the witnesses Republicans chose to enlighten us about healthcare affordability.
I would ask, Mr. Chairman, unanimous consent to put into the record my request to Dr. Oz to answer these questions about the fraudsters, which he's been unable to answer for months.
Without objection.
Thank you.
Mr. Smith.
Thank you, Mr. Chairman. Certainly thank you to our witnesses for voluntarily appearing here today. I think we're having conversations that need to be had, and I hope that we can work together for constructive solutions, that we can share thoughtful ideas, that we can recognize that I think everyone on this dais wants our country to do better by the people as it relates to health care. I don't have to tell you, there are glaring problems that we face. Incidentally, Mr. Joyner, thank you for mentioning my bill, ECAPS, ensuring community access to pharmacy services. I think that's one way that we could increase access, utilize the expertise of highly trained medical professionals more efficiently and effectively, and certainly as it would benefit the seniors and that access, both rural and urban. And I think of just the, various descriptions of the problem at hand here of high premiums. Now, I had someone describe the situation of the subsidy as we're shoveling government subsidies to paper over a problem. That's true. That it really, I think, conceals the problem at hand. I mean, I think back to before the ACA, the so-called Affordable Care Act, that we had the high-risk pool for those with pre-existing conditions, and now that seems like a bargain compared to what the individual market is having to pay. And there were signs, as all of the debate was happening in the run-up to the so-called ACA, there were warnings that we better be careful in what this is going to do to the individual market, and here we are. Now, we've been learning a lot over the last couple of years especially, but I'm concerned about just the abuses of the system, and perhaps whether someone might want to call it fraud, someone might want to call it unintentional enrollment. The results are the same. And we know that there's a large number of folks who have recently been eligible for zero premium plans. And recent studies have shown that in 2024, nearly 12 million ACA enrollees, up to 35% of all enrollees in ACA, did not log any claims or use their plans at all during the plan year. Now, I would like to think that there is absolutely no need, although I think it's generally a good idea to at least get an annual physical. But I'm genuinely curious, Ms. Boudreau, do we assume that many folks, 35% of those who are enrolled, are just so healthy that they don't need to see a doctor at all?
Well, thank you for the question, Congressman. As we think about this overall, insurance is used for protection as well as use. So our numbers, I share your concern about potential fraud and catching that and making sure that we have integrity in the eligibility process. Our numbers show that it's roughly around 15% in total that we get our enrollment from the exchanges, both federal and state. The state exchanges we work directly with and do a bit better. But again, we share the issue of integrity, marketplace, integrity around ensuring that eligibility has people eligible for these are in those programs, as well as we think a stable program requires continuous coverage, requires us to be able to deliver preventative care. And so those are all really important pieces of keeping.
Right. Certainly the fundamental concepts of pooled risk are important, and I hope that we can have a good conversation about that too. Now, with all of these debates and various data points circling, I did come across some data here that Mr. Cordani, I'm turning to you to perhaps offer some background and explanation. Now, it seems apparent that in 2024, your company, obviously, as most did, took a rate increase. I think one state under your plan saw a 40% premium increase. Now, in the earnings call on January 30th, 2025, you said that in 2024, that you returned $8.6 billion to shareholders through dividends and share repurchase. That seems glaringly imbalanced in terms of what needs to be done for ratepayers, ultimately healthcare, and certainly shareholder priorities. How can you give us some background there? And I mean, because on the surface, it seems like shareholders receive great benefits, certainly at the considerable expense of patients.
Congressman, thank you for the question. Two different points. One, I think your initial comment is relative to the exchange business in the year you identified. The year prior to that, we lost a significant amount of money in that specific state because we had an inordinate amount of growth.
Okay, so other states perhaps a lower increase, but certainly
lower
still an increase.
But meaningful increases. Point two is we've been in the Obamacare exchanges since its inception in 2014, and we've only been profitable in 2 out of those cumulative number of years. To your broader point, the ability to purchase back stock in that time frame was aided by divestitures of businesses. So we, over the last 5 years, we've divested several businesses, as well as successfully have been able to run our largely employer-sponsored business. So I would ask you to disconnect the purchase of stock heavily correlated toward divestitures and operating cash flow. We have not made money in the exchange business for quite some time. And in the United States, the vast majority of customers we serve are in the employer-sponsored market and in a self-funded way.
I understand that, and my time has expired, but I'm concerned about the employer-sponsored market, especially public sector, where expenses have gone up and coverage has gone down. Thank you.
What we've just witnessed, ladies and gentlemen, is a masterclass in political theater and a sobering reminder of why American healthcare remains fundamentally broken. Representative Adrian Smith, a Republican who has built his career on dismantling the Affordable Care Act, sat across from insurance executives and asked them with apparent sincerity why healthcare costs are spiraling out of control. The irony is not lost on anyone paying attention. This is the same Adrian Smith who has voted repeatedly over 50 times by most counts to repeal, defund, or sabotage the very law that extended coverage to tens of millions of Americans. This is the same congressman whose own constituents in Nebraska's 3rd District now face some of the steepest premium increases in the entire state, precisely because his party allowed enhanced subsidies to expire just weeks ago. And yet, there he sat, lamenting high premiums and pointing fingers at fraud in the system. The cognitive dissonance would be remarkable if it weren't so tragically predictable. Now, let's talk about what Mr. Cordani, the CEO of Cigna, told us today. He claimed with a straight face that his company has only been profitable in 2 years since entering the Obamacare exchanges in 2014. He asked us to disconnect the $8.6 billion returned to shareholders from the 40% premium increases imposed on patients. He wants us to believe these are separate ledgers, separate realities. But here's what Mr. Cordani didn't mention. His total compensation in 2021 alone exceeded $91 million. The Cigna Group reported revenues of $247 billion in 2024. These are not the numbers of a struggling enterprise. These are the numbers of an industry that has perfected the art of privatizing profits while socializing blame. And this gets to the heart of the Republican healthcare strategy, or rather, the absence of one. For 15 years, the GOP has promised to repeal and replace the Affordable Care Act. For 15 years, they've offered nothing but sabotage, litigation, and empty rhetoric. Meanwhile, let's consider what actually happened when enhanced ACA subsidies expired at the end of 2025. Premiums doubled. In some cases, they tripled. Families who were paying manageable monthly costs suddenly faced bills of several $1,000s. And who suffered most? Not the wealthy, not those with generous employer-sponsored plans. No, it was working families, small business owners, farmers, early retirees. the very people Representative Smith claims to represent. The Democrats, it should be noted, fought for 3 years to extend those subsidies. They were blocked at every turn by a Republican Congress more interested in ideological purity than in the material well-being of their constituents. And now we have these hearings. These performances, Republicans hauling in insurance executives, extracting vague admissions of systemic failure, and offering precisely zero legislative solutions. It's accountability theater without the accountability. What struck me most in today's testimony was what wasn't said. No one mentioned the role of hospital consolidation in driving up costs. No one addressed the pharmaceutical industry's unchecked pricing power. No one acknowledged that the United States remains the only wealthy nation on Earth where medical bankruptcy is a common occurrence, where insulin prices can determine whether someone lives or dies, where a cancer diagnosis can mean financial ruin even for the insured. These are policy choices. They are the inevitable consequences of a system designed to generate shareholder value rather than patient outcomes. And until we confront that fundamental reality, hearings like this one will remain what they are: sound and fury, signifying nothing. The question is not whether the system is broken. The question is whether we have the political courage to fix it.